Dear all, today we'll be learning about point of care testing devices. This topic belongs to your module 5, where the module itself starts with several kinds of point of care devices, and we'll be dealing with the introduction of it and more in device construction and how they do it. We'll be following in the further classes. So today we'll see what are these devices and how they are being used and what is the advantages of using this point of care devices. Most of us, we would have seen this point of care devices in our day-to-day life, but we would not have understood the name. What are those point of care? So point of care is nothing but at that particular point, instantly when you put an analyte into a device and you get an answer for it, that is, you get a feedback or a analyte concentration from it, it is called as a point of care device. It may be as simple as a pregnancy device where we have put a drop of urine and you get the answer whether it is positive or negative. Or like a glucometer where we put a drop of blood to the strip and instantly it gives you the reading. So this kind of instant feedback or instant result, what you get from the device is called as a point of care devices. So these are some examples. So the bottom one that is being it's a pulse oximeter. So most of us would have come to know what is a pulse oximeter during the COVID times because most of us purchased and there were even offers on this pulse oximeter. It cost around 1,000 rupees and like it gives a lot of information, especially about our saturated oxygen level, SpO2 level it gives. So for a normal person, we need around 95% to 97%. When the oxygen level drops down, you can come to a conclusion that you have a problem with the lungs or the breathing or the respiration part. So this is a very good point of care devices where you instantly get the oxygen concentration. Here in this example, you can see that the pulse oximeter is being connected to a smartwatch. This is a testing device like for the urine testing, which can analyze a lot of things like blood, the glucose level, the creatinine level, etc. And you have a strip and there is a normal readings and what is a color for each of the concentration is also given, which any layman can compare with the label that has been given here with the color concentration and come to a conclusion like what is the concentration there. And this is a glucometer. You keep a drop of blood to the strip and instantly you get the readings. So this is also, and this is a laboratory based point of care device where you put a blood in the syringe form into the machine and a lot of things can be analyzed at a particular point, that is like cholesterol concentration, okay, what is the creatinine level, what is the WBC, RBC count, like this you can get the varied level of readings at one particular time. So this is very good for our for our medical testing, especially even you can have this point of care testing devices at your home. So most of the diabetic persons, they at home they'll be carrying the or wherever they go, they will be carrying the glucometer with them. So this glucometer will analyze the sugar concentration. So whenever you feel little dizzy or uneasiness or any problem, you can just keep one drop of blood and check what is the glucose concentration that is present in your blood. And accordingly, you can do your a remedial action like take a medication or whatever rest you require or whatever it is. So this is like a very useful thing, especially when you understand you have some variations in your blood of certain quantity of certain components. You can always carry it along, and these devices are usually small so that you can carry it wherever you want. So these are diagnosis based, mainly designed so that wherever the patient is located, you can analyze it directly rather than calling the patient to a particular physical facility. Actually speaking, this is a very old technology. People have spoken about it at 1550 BC itself. So here, if you look at the Egyptians used a very simple technique. They keep a drop of urine and they leave some ants around them. So if the ants are trying to move near the urine, that means your glucose level is high in the blood. So depending upon the number of ants that move towards the urine denotes whether you are highly glycemic or low glycemic. So this is an ancient technology that is being used. So this itself is, you can tell, this is a point of care testing that is being done. Right. So this is a small example to tell, like when it is near your bedside, or you use that point of care devices as an accessory on your body in the form of a smartwatch or as a pendant or anything. So that give you a lot of ease. That is, something is monitoring your uh, system continuously. Even our smartwatches, what we carry nowadays, takes basic things like what is the heart rate. Though it is not very accurate, you will get to know some idea about what is your heart rate, what is oxygen level present in your bed. So all this you directly get it even from a smartwatch. So you will have a satisfaction that somebody is monitoring you continuously. So you will be liking the device. So the criteria for this rapid testing that has been designed by WHO is like, when you do some point of care testing device, you should always take society in mind. If you look at this glucometer that cost around only 1,000 rupees, and the strips will cost around some 350 rupees for some 10 strips or 15 strips. So these are highly affordable by a common people. So if you look at India, more than 70% of the people are diabetic, and if everybody has to buy this and keep it at home, it should be at some affordable rate. So this has to be kept in mind when you design some point of care devices. So first thing is, it should be a assured one. Assured criteria is nothing but it should be affordable. Your point of care should be very sensitive, specific in analyzing, user friendly. Everyone should be able to use, and should be very simple to perform, should be rapid, giving the results within some time. Even 30 minutes is a very big time, what I can say. It's a long duration because people want instant results, that is within some seconds, within some minutes. So this will be good if you have a rapid result, and it should be equipment free, that you can, if it is like a paper device is being used or a simple strip is used without much equipment, it is very, very easy to handle. And it should be deliverable to those who need the test. Those who request, yes, they should be able to analyze it and do it. So these are some criteria kept for point of care testing devices. So this will improve the quality of the patient, efficiency of the patient, physician and patient satisfaction, patient education, decrease liability risk, minimize burden at central level. So if you go for a lab, it's a long procedure that one day you take an appointment, you give your blood. In case of diabetes, you have to plan a day before, because you have to give the blood as before food and after food. So at least some 12 hours of fastation is required for you when you go and give your blood. So all this has to be pre-planned. You have to go to a clinic, you have to look at your condition, and then you give a blood. One day they take for analyzing, and then the next day you will get the result, and then you consult your doctor. Then doctor will prescribe you the medication. So this is a traditional way of doing the medication, which is given in the first half of the slide. Yeah, you analyze, you give the sample, then the report, whatever is being generated, will go to the doctor. Doctor will analyze, and then will. So this is like 1 to 2 or maybe 3 days issue. But in the point of care devices, directly you can analyze. You have a question, you can go back to your doctor, discuss with him, and get a treatment done or a medication done instantly. So that is the advantage of point of care testing devices. And there are some disadvantages also with respect to them. So you need to train the people who are using in case of some sophisticated devices. Caregivers has to, like, suppose if the person is bedridden, so the point of care like monitoring a ECG or monitoring a blood pressure will be instantly done. So in such cases, the caretakers or caregivers who are nearby them should be able to analyze whether the reading is going beyond a limit or within the limit. So that has to be taken care. And if there is an increased risk of errors, there is wrong results are being produced, then you have to take more care in interpreting the results. So the point of care, there are a lot of things now present in our market. So these are basic things. That is, it should be transportable. That is, as I told you, if the person has to on a travel, has to carry it somewhere, yes, it should be possible for them. It should be disposable, like some of the things like even the strips in the glucometer or a pregnancy device, checking device, all these are disposable so that cross contamination or false positive or negative can be avoided. They are portable. They can be carried from one place to another. These testing things are handheld, they are very rapid, so they may be benchtop. So all this can be done with the POCT, and there are some environments where you can do the point of care testing, that is from the home, community pharmacists, some place, health centers, anywhere you can use this point of care devices. So this is very easy now, the clinics are not overloaded, the laboratories are not overloaded. You can self-analyze the things. Though there are a lot of disadvantages, like there will be false positive and false interpretation by the patient. So those things to be also taken care. And those who do this, yes, they have to be well trained. And even if there is a false positive or negative, the people should be able to know the results. And ideal requirements is that the result should be very fast, very specific, and it should work according to the protocol. And the analysis like blood, urine, things should be done properly, and the results should be communicated. So let's go to the individual components that are present. So there are a lot of components. As I told you, in the further classes, I'll be explaining to you about how the microfluidic channel look and how the analysis can be done. Whereas the individual component of the POCT devices are like barcode identification, sample delivery. Okay, there will be reaction cell, sensors, there will be control and management, data management, storage, manufacturing requirements. These are some individual components that are present. And the sensing type, there are basically in market, there are two types. One is chemical sensors and biosensors. So we are bothered about the POCT, that is a point of care testing only based upon the biosensor based. So when you look at the biosensor based, you know what are the molecules being used, right? Enzyme, antibody, nucleic acid, bacteria, and you have a transducer to check the change, and then you amplify and you look at the signal. So this is a very basic thing of a biosensor making, which will be even used in the POCT devices. So the analytes they use is mainly the blood and urine, glucose, cardiac. There are some biomarkers used, sometimes pH, electrolytes, metabolites. These all can be used as a POCT devices. So there are different methods they use, something like dip sticks, small sticks which they dip into the analyte and you get whether they are positive or negative. Sometimes complex strips are used. Sometimes immunological sensors are also used in the POCT devices. So now this is an example of device where you put the sample here. It's based upon a cellulose based, and as they move towards this, there will be signal analysis. So this is the top of the device, and this is a disposable device. And if you look at the biological molecule what they are using, so this is for the component called troponin T. So this is an immunological assay just to check whether you have the presence of a troponin T, which is a component in the blood. So now when you keep the blood here, right? So there will be a immunological reaction. Immunological reaction, maybe it is like a enzyme and a substrate reaction. So if your troponin is an kind of an molecule which can be analyzed with respect to a biomolecule called as here there is some immunological reaction that is being given, right? This is a sandwich type of molecule. So the antibodies against this troponin molecule will be designed. So if there is a similarity in the receptor, if there is a similarity in the receptor will go and bind to this troponin molecule. And if there is a positive reaction, you can have a color reaction or anything. So this is paper-based, that is cellulose-based sensor. So here, if there is a positive reaction, there should be some color, and negative reaction, there should be some color. So there will be always a control and a signal production. So here, if you look, there is a streptavidin molecule that is being attached. So as I told you, this is a sandwich technique. Sandwich technique means the antibody is uh, designed against the molecule, and secondary antibodies will also be there, and the secondary antibodies will be attached to certain color and reactions, right? So this is a molecule which is being placed in the blood, that is TNT, and the molecule that is a secondary antibodies will come and bind to it. And suppose the molecules like streptavidin will be present and the signal conduction will happen, and there will be a reaction for the control just to check whether the disk is working or not. So for a control, there will be one color, and if there is a positive reaction, there will be one more color which you'll be able to detect. So that's a very easy way. And this is a strip technique where you use a strip to detect. So this basic example is a glucose sensor, which we have seen mainly most of the modules. This glucose sensor is repeating, and as you are aware, the enzyme that is being used for sensing is the glucose oxidase, and this glucose oxidase, when combined with the glucose, they produce the reactions will produce some drip in the pH due to the negative ion production, and which will be detected by the electrode present, which will detect the concentration of the glucose. This is for the anticoagulant therapy. This device is similar looking to the glucose. So you can check whether the clot is formed or not. Keep one drop of blood, and how long is that anticoagulant therapy will be efficient on certain patient can be checked. So coagulation, so some of the people, the blood clotting will happen, so which is called as a coagulation of the blood. So during certain medication or during even certain surgical procedure, you may need to add an anticoagulant for it. So when you're adding an anticoagulant, so when the person is in the therapy, so you want to look at what time your blood is getting coagulated, you can use this. So these sensors are basically based upon the light optical sensor. And there are some blood gas analyzer, that is the carbon dioxide level and the oxygen level analyzer. So this is a machine. You take some blood, you put into the machine, immediately you will get to know what is the carbon dioxide limit present, oxygen limit present, and other ions also can be done with this blood and glass analyzer. This is multi-use cartridge and benchtop systems where you have a lot of devices checked, or a lot of parameters checked at a particular time. This is a non-invasive POCT where you have the pulse oximeter that is being attached to it, and then you can analyze what are the uh, oxygen level present. So you can see an infant baby which is in a neonatal ICU, and they put the device and you can immediately find out what is the oxygen level that is being present. And there are glucose watch, right? So that based upon some electrical signals from the blood, you can take out the signals and find out uh, what level of glucose is present. So what are the risk of PCOT is that yes, you should be very cautious, and you should have an understanding of using these devices. Suppose sometimes there will be a false negative, and people should not be panic about it and should not go for a self-defined medication when you come across certain parameters in your blood or in your urine, etc. So always, like when you, even if it is a blood glucose sensor, suddenly you see the glucose level is being shoot up in your blood, and you have a doubt that it may not be so or something, you can always approach a clinic for a secondary confirmation before coming into some conclusion and taking self-medication. So that is a risk of PCOT. That is, people should not be very panic about the readings and go and directly go to some conclusion. And one more problem with the risk is that there should not be any cross contamination. Suppose you are taking the infected blood and you're putting onto a device, so that may be infectious to the other people also. So that should be taken care. And what environment you're using, Uh, right, in case if it is like a pregnancy kit, so that is based upon certain hormones or protein molecules. So these protein molecules, when they are heated or frozen, they may be inactive sometimes, or they may be denatured if it is being heated. So what temperature you have to store those kits when you are using also are important. And when you are using this dipstick method or even the strips, so they also should be kept somewhere away from light, humidity, moisture. So you should take care that whether uh, uh, they are being like disturbed, or even if there is a moisture is present, there may be some fungal contamination. The contaminations may result in false positive or negative. So that also to be taken care. And what is the future is that everybody in the future may be having certain small devices which can sense the things instantly. This is an example of a contact lens where the glucose sensing is like directly done from the lens itself. So for the glycemic patient, that is for the cataract person, they can come to know like how far is the cataract development, and like whether there is a surgical requirement. So all this data can be transmitted to a data transmitter signal control devices. So these are the future of PCOT. So all of you uh, will be aware by now that there are a lot of things. So what are the basic techniques or examples what I was dealing with today is, one is like strip based, where you have a electrode there, a small devised electrode. Sometimes it is paper based, where some enzymes or antibodies are uh, immobilized in them. Sometimes they are very sensor based. So these all things can be used in the PCOT devices. I hope the class was useful to you. And in further classes, we'll be dealing with how these devices are manufactured, what are the channels used, what are the signal pathways, and how the fabrication is done. All these things we'll see in the future classes. And that's it for today. Thank you all. Any questions? You can always post me the questions. Thank you all.